The Health Minister, Dr. Zweli Mkhize, says his department is hoping to vaccinate about 67% of the population by the end of 2021 against COVID-19. But it's going to be tricky considering the country's ailing economy and the high cost of vaccines. There's a lot of talk now of partnership between the public and the private sector. I want to talk to Dr. Sipho Kabane now from the Council for Medical Schemes to discuss financial assistance in procuring the vaccine. Doctor, good afternoon to you. Thank you for holding and thank you for your time. Before we get to the actual cost of the vaccines and the role that medical aid schemes are going to play, I wonder if you could just give us a brief assessment of the situation from your perspective right now. We know, for instance, that the National Command Council is going to meet at 9 o'clock tomorrow morning as the death toll continues to rise in South Africa. It seems to be getting worse, doesn't it?
Well, it does seem to be getting worse here. And those numbers of new cases, you know, the active cases and the deaths are not encouraging.
So,
but, Jeremy, from a regulator's perspective here, I think this story for us started with the minister giving us a directive really to engage with the privately funded industry of medical schemes that we regulate. And that directive came around the 18th of December. And the CMS, which is the designated regulator for schemes, actually established a team, an internal team that started to engage with the industry. And we had a very successful meeting on the 22nd of December, where three big areas, of discussions were identified. Firstly, there was the declaration of COVID-19 vaccine for inclusion as part of the prescribed minimum benefit. This basically means that all the schemes should be able to fund anybody that is appropriately referred for the vaccine, irrespective of the scheme that you belong to. And then the second area here was a number of principles that were discussed, and these included ensuring that there's universal access, and availability and provision for the vaccine, and that whatever efforts that we try to make shouldn't just be focused on medical scheme members, but should look at addressing, the national issue as it stands here. And basically, there was also agreement that we need national coordination. And we're happy that the minister has established the committees that he has, through which we are going to be making our contributions together with the schemes here. But obviously, one of the key principles, it's the principle of social solidarity and cross-subsidization, which has been agreed upon, at a principle level. But there are a number of detailed issues that still need to be engaged and discussed with the industry.
Dr. Kabane, let me ask you this, and I'm glad that there appears to be concordance as far as the regulator and government is concerned, but in many ways are you not navigating in the dark here, given that we have very little idea, one, of what this vaccine is going to cost, and two, what the distribution strategy is?
Jeremy, those are precisely the issues that we are busy engaging with the industry associations. And by that I mean the Board of Healthcare Funders, Health Funders Association. This is basically the associations of medical schemes and administrators in the industry. And I'm sure whilst we're working from not a very clear perspective right now, we will bring in the experts that will shine the light to the issues so that when we make these recommendations, to government, they will be well thought out, rigorous, and will provide a sustainable solution.
But Dr. Kabane, you will concede that the clock is ticking here. There's been a lot of criticism, for instance, that government is not moving quick enough to procure the vaccine. We're now hearing possibly by the end of 2021 where there will be mass vaccines given. Is your organisation and others actually aware of the urgency here? Everyone seems to be moving at snail's pace.
Well, Jeremy, I think part of the challenge is that we're dealing with uncharted territory here we're very much alive to the urgency. You've already mentioned the numbers of increasing new cases. And clearly, if we see the vaccine as one of the key solutions to, finally getting rid of COVID, then we'll put our efforts towards ensuring that here. And that's why we're working together with the National Ministry as well as the industry. So we're not sitting in one corner trying to figure this thing out.
So give me a timeline then about when you think your deliberations with government will be over, so we have agreement then on the on how people are going to be assisted in paying for the vaccine.
Yeah, listen, Jeremy, I think we've got a meeting that is scheduled that we're trying to finalize for Friday with the industry. And basically, all these key detailed issues are what those discussions will be about. How do you ensure that when that vaccine, is in the country, it's going to be distributed fairly, appropriately, transparently? How are we going to ensure that scheme members as well as non-scheme members have a chance of getting this vaccine, especially those that have been prioritized for this year?
Dr. Kabane, just a final question to you. You spoke about social solidarity, and I understand that that is important. Are you satisfied as the Council for Medical Schemes that all your members are on the same page, that everyone ultimately will buy into whatever agreement you reach?
Well, at this stage, Jeremy, we've engaged the industry associations, but next week we'll be talking to principal officers of schemes. And through those channels, I'm sure we'll be able to reach members. But I hope that, people will understand that golden goal of 67% herd immunity cannot be achieved just by vaccinating scheme members only. We need to venture outside that pool. We need to assist government in whatever way that we can, because this is a national and international crisis.
I'm going to thank you for joining us, Dr. Sipho Kabane from the Council for Medical Schemes here on Tuesday lunchtime. Now.